everyone, and welcome back to the session of SP Koppikar's clinical experience of 100 points necessary for clinical understanding. And this webinar is extracted from the book of that clinical experience of 70 years by SP Kapoor. We have collected some important 100 points which are necessary for our clinical practice. So along with that, we have added some of the gems of understanding comparison patterns, relationships, and some confirmatory remedies of each remedy, what was Sir has described in his book. And along with that, we have added some clinical understanding of my cases and a study from my guru cases. We added some extra information for you all. So welcome you all to today's session. So coming to the first clinical tip or the first point of today's session is that, so in cases of involuntary urging of stool, especially involuntary urging of stool, where patient complains of afraid of moving forward, right? Moving forward, then think of the remedy crotontic. At the same time, crotontic has action of allos as very similar action. Both crotontic and allos have the same similar action, cannot able to move forward in involuntary urging of stool. But in crotontic, the patient has some skin complaints alternating with this rectum complaints. And crotontic diarrhea is like gunshot diarrhea, gushing diarrhea. Where in allos, you can see the insecurity at the rectum feeling. And allos urging to involuntary stool can be interlinked with the lumbar pains, with backaches. But in crotontic, it is not like that. And crotontic is one remedy, one such a beautiful remedy. You can think of skin eruptions or eczema in the scrotum. Eczema of scrotum cases, crotontic does wonders in low potency. So some of the great diarrhea remedies you can think of is nitrum sulf, podophyllum, thuja, jalapa, and jatropha, thrombidium, sulfur, and china. And I will tell you thrombidium. And thrombidium is one beautiful remedy in cases of naxomica, where you have prescribed naxomica. It is not at all helping. Patient tells doctor, after eating, immediately I go to stool. After drinking, immediately I go to stool. And you have prescribed naxomica, but not at all helping. In such cases, you can think of thrombidium. It's a beautiful remedy for dysentery cases. I did one beautiful case with thrombidium, and it has helped well. It has helped well. And we all know sulfur, some confirmatory symptoms as well, right? This is the clinical tip or the point one of today's session. Is it clear? Is it going well? Voice is clear, slide is moving. Yes, thank you. Thank you. Thank you. So coming to the next clinical tip of today's session is wait for a while. I think the slide is okay. Some mistake has happened. Okay, so we'll go for this. You can zoom it and no need to take any screenshots. If possible, we'll be sharing the PPT for you all as well. So coming to the point two of today's session, for pains of cancer. So in cases of cancerous pains, in cases of cancerous operative pains, then think of this remedy, Cilicia, especially in 3x, given by Dr. Hughes. So Cilicia is one of the beautiful remedy you can think of pains, especially of the cancer or in cancerous pains. And Cilicia is a beautiful remedy. It's a beautiful remedy for a cancer of lip cases. Cancer of lip cases with corners are cracked corners like Kondurango. And here, if you compare with Kondurango is also beautiful remedy for cancer, especially of stomach and esophagus cases. Esophagus of cancer, cancer of stomach with cracks at the corners of the lips, especially see these corners of the lips are cracked. It's Kondurango with Cilicia with cancer of lips. You can think of that remedy. Coming to the next, some additional information for you all. Burning pains. Pains as if live coals were on the part of cancer. So in cancerous cases, there is a lot of burning, like live coal like burning. It's like fire like burning. You can think of the remedy euphorbium. It's a beautiful remedy, euphorbium. And whenever you to prescribe euphorbium and anthracynum and arsenic like state you can see in euphorbium. Anthracynum is also one beautiful remedy for abscess, carbuncles, and boils, especially like burning pains. Like arsenic, you can say. It works wonders. And this sentence was given in Allen's keynotes if you read anthracynum relationships. Coming to the next point, hydrastis. Hydrastis is beautiful remedy for cancer as well. In cases of pains of cancer, and hydrastis has this action retards the growth of cancer. In cancerous cases, that retards the growth of cancer. And hydrastis also have same cancer of lip like Cilicia, like Cilicia. And one of the beautiful confirmatory symptom of hydrastis is, especially they don't like to eat vegetables. If they eat vegetables, if they eat bread, that causes diarrhea. That is clinical confirmatory of hydrastis. Is it clear? Coming to the third point for you. So learn to picturize the keynote as you read. Imagine yourself as a patient or provers suffering from that symptom complex. Dramatic this mentally. So why I included this point is, so generally we read Metro Medica, right? We just read the symptom or symptomology from whatever book you are reading. So don't just mug up or don't just read it. Try to understand the picture behind it. Try to understand the picture behind it. I will tell you a beautiful example. Like, for example, if you're reading Naxomica, Naxomica is more of irritability, anger, very, very jealous, very, very passionate as well. Now you interlink this jealous nature. Now interlink this irritability, anger nature with some of your friends, with some of your relatives, or some other celebrity personalities, some other films which you have seen past. Just interlink with them, then you will understand the clear picture. Then you can imagine a picture of Naxomica very clearly. So if you try to imagine, if you try to picturize each remedy in your mind, you can see the patient when come to your clinic. This is what I do with mine. And try to read Naxomica is not from one book. Try to refer Naxomica from different books. Whenever you are reading one remedy, try to read it from first start with Nash Medremedica. It's a beautiful remedy, Nash Therapeutics. If you don't read Nash, your life will be Satyanash. This was written by Lipe. So then enter into the Boric, then enter into the Boger, then enter into the Fatak, then enter into the clerks. So like that, try to interlink what was the pattern is running through in each remedy. So if you seek common pattern of irritability, common pattern of anger, common pattern of jealous, common pattern of passionate, common pattern of constipation, rectum symptoms of Naxomica, that is the gist for you. That is the core. That is the genius of Naxomica. Then you need not to refer Naxomica for other symptoms because you have understood the core of Naxomica. That is most important for clinical practice. In the same way, if you are trying to read a prosperous remedy, tall, thin lady or men, craves for ice creams, craves for cold drinks, oversensitivity, very, very sympathetic remedy. So you see helping nature, right? Very, very helping nature. Like, for example, if you picturize this with Sonu Sood, the great celebrity, he is very sympathetic. He comes whenever there is a trouble. He can be prosperous, he can be causticum, he can be nitric acid. Now, there you need to understand how we can differentiate. Sonu Sood is very tall, thin. You are imagining a person of that remedy. So like this, you need to interlink. If you interlink Barretta cup, very lazy, dwarfism, milestones delayed, Patient says or parent says he cannot even talk with someone, doctor. Very, very shy nature, and his milestones delayed, very lazy, not able to read. See the picturization. See the picturization. This is how Metromedica is learned. This is how Metromedica we need to learn. Understand the gist. No need to learn each and everything from each remedy. That is none of our business. In clinical practice, especially, I'm saying, not from exam point of view. Try to understand the core, the genius, what Boger has said for us. Is it clear? Coming to the next point of today's remedy. See here, you see, in cases of shouting that fire was burning, inside which he demanded large quantity of cold pot water rolling along the floor to cool his burning body. Think of the remedy, sickle core. Sickle core is one beautiful remedy for gangrenous affections, for ulcers, especially diabetic retinitis, diabetic gangrenes, diabetic ulcers with hemorrhage tendency, and patient complaints like inside very much burning, like arsenic, like anthracene, you can see. The burning is like a fire. And patient says, immediately I need some cold. I need to put pot water of cold rolling along the floor, or I need to just pour some cold water to feel better. It is sickle core. And sickle core comes very close to like carbohydrate in wants to be fanned. Sickle core also has this symptom, want to be fanned, especially with burning sensation. Burning sensation. You can think of this remedy in diabetic retinitis, diabetic gangrenes, in varicose veins, where the blood is stagnated with blackish discoloration, with a lot of burnings. Sulfur also cools his feet like medorinum and pulsatilla. Now I will tell you, sulfur is one of the beautiful remedy. The patient comes and says, doctor, now my feet is burning. My feet burns a lot, especially at night. Night feet's burning, and I cannot even put a bedsheet cover. I need to cover my bedsheet, but I keep my legs outside the blanket. I cannot cover it. So much burning I can see. I want some cool air to come. Then only my feet feels very much relaxed. Very much relaxed. Only three remedies: sulfur, medorinum, and pulsatilla. These are key confirmatory. Whenever you are about to prescribe sulfur, medo, pulsatilla, ask you while sleeping, do you take blanket? Patient says yes. If legs are inside or outside, ask that. Patient confidently says my legs will be keeping outside. This is the key confirmatory of this beautiful remedy. This beautiful. And medorinum, we all know, recurrent past UTI symptoms, very lazy, very, very postponement, at the same time, passionate desire for. And medorinum is one of the beautiful remedy for hundreds of cravings in homeopathic medicine. Hundreds of cravings. Pani puri, pizzas, whatever. He says, I like that. He says, I like that. Even they craves for fruits like seasonal fruits, watermelons, cucumbers, and medorinum patients sleeps on the belly, on the abdomen. That is one of the key confirmatory again. So pulsatilla, we all know. Coming to the next, arnica finds bed hard. So arnica patients want to be bed hard, finds bed hard. Opium, bed feels very hot, very hot. Coming to the next remedy, that is podophyllum here. Podophyllum is a remedy for loquacity during chills. At the chill stage, podophyllum starts speaking, starts talking. Very much loquacity in the chill stage is podophyllum. And podophyllum is beautiful remedy for liver affections. I will tell you one beautiful clinical tip for you. If you get a patient who having this liver complaints, try to see me. And the patient says, doctor, see here it is, here liver pain. This is so much of pain. And patient says, doctor, if I rub like this, I feel much better. So rubbing at the liver region, patient feels much better. The remedy is podophyllum. The remedy is podophyllum. Coming to the next, lachesis and tucramarum, where the remedies for loquacity, especially of heat stage. With heat stage, lachesis and tucramarum are very much loquacity, very much loquacity. We all know lachesis, jealous nature, suspicious, snake remedy, lot of talkatives, you can see. And next remedy, tucramarum, is a beautiful remedy for nasal polyps if you give in 50 m one single dose. Nash has mentioned in his Metromedica. And other important thing you can think of tucramarum is it has oversensitivity to the remedies or some allopathic drugs has taken, then the patient comes into the state of oversensitive to that remedies or that medicines. You can think of the remedy to Maravilla. For nasal polyps and for chronic atrophic rhinitis also, this remedy works wonders. Coming into the caladium loquacity during sweat. So caladium is a beautiful remedy in sexual excess, like fluoric acid. Very much sexual desire. Caladium has effects of masturbation. And for tobacco cravings, if a patient craves for tobacco, comes to you to restrict that feeling, you can think of caladium with a lot of sexual desire. And interesting point is this: you see, caladium has this symptom. Caladium is a beautiful remedy for tobacco cravings. They crave for tobacco. At the same time, they cannot tolerate the smell of tobacco. This is one thing. They person who craves for tobacco, they cannot tolerate the smell of that. That is caladium. Lot of sexuality desire, elements from masturbation comes very, very close to fluoric acid. Coming into the next point here, charcoal longing for them. You can think of cicuta there. Charcoal longing for them, you can give cicuta. I think the line is missed, cicuta. What is the remedy for point 4? Sickle core, sickle core. See, if you have any doubts, we'll have a discussion at the last. We'll surely tell you. We'll see the messages at the last and we'll respond for you. So charcoal longing for, you can think of the remedy cicuta. Some other remedies with this is aluminum, conia maculatum, nitric acid, naxomica, calcarea, and sorinum. So we all know aluminum is a beautiful remedy for patients who have that memory loss, identity loss, especially in children where parents are strictly dominated, cannot able to think, do whatever they want to do, always depend upon some others, always depend upon the parents. That's why there is one rubric of aluminum, delusion, identity lost. And we have done this polycrust session of alumina, abrotinum, aconite, ammonium carb, 5 polycrust remedies. It's a paid session. If someone who wanted, they can text me. Alumina is a beautiful, beautiful remedy. Other rubric, I'll tell you. Delusion, robot he is. You can understand how alumina patient feels. He feels a robot. Conium, it's a beautiful remedy for old age, bachelor lives, right? And one of the key confirmatory for conium to prescribe is vertigo. Other thing is earwax. Earwax is the key confirmatory of conium. Earwax. So we all know nitric acid, naxomica, calcarea, and sorinum. It's a very polycrust remedy. Everyone knows it. Coming to the point 7, see this, purpural convolutions immediately after delivery. So immediately after delivery, they get these purpural convolutions. You can think of the remedy amylonitrosome. It's a beautiful remedy, amylonitrosome, especially the most key confirmatory of amylonitrosome is they always constantly stretch. They feel constantly stretching feels much better and constant yanning. Constant yanning you can see in this remedy, amylonitrosome. Next thing, convolutions delivery after immediately, amylonitrosome and antimonium tartaricum. We generally don't think of this remedy. Antimonium tartaricum in convolutions. Purpural convolutions with lot of streaking, lot of crying, you can think of this remedy. Hyosemus, iodum, and lachesis. Hyosemus, lot of sexuality, mania like stramonium belladonna, fear of running water, aversion to apple, cannot able to eat. That is the state of Hyosemus. Right? Iodum is the hottest remedy in our Medica with emaciation, with goiter complaints, you can think of this. So other thing here, purpural convolutions with blindness. With blindness, they get the state of these purpural convolutions. Or mure, cocculus, coppermet. So coppermet to prescribe in convolutions, think they have lot of spasms, even spasm or constriction feeling in the cuff, complete spasms. To prescribe copper, you need to have spasms, constriction, lot of constrictions in convolutions. Other remedy, purpural convolutions with sweating, with fear of terror. A terror remedy is stramonium. They always desire for light, dark aggravation, fear of dark. Even while sleeping, they on the light. That is stramonium. That is stramonium. Coming to the next point here, gelsemium to cease labor pains along with some remedies comes to role of play are colophyllum and coppermet. So to cease the labor pains, one remedy we can think of what sir has mentioned in his book is gelsemium. Gelsemium. And some other remedies we have added for you all. Some remedies comes into the role of play are colophyllum and coppermet. Asthma with labor pains. Labor pains alternating with asthma. Lobelia. Lobelia infiltrata is one beautiful remedy for respiratory complaints alternating with gastric complaints. Alternating with gastric complaints. Labor pains, a lot of tormenting like labor pains. Cannot able to bear is colophyllum. Is colophyllum. Here you see other remedy. Labor pains, disseparate make her aurum, chamomilla, and coffea. So generally we can think these remedies. If you refer repertory, mind beside himself pains from. In that chamomilla and coffea are one of the beautiful remedies. For pains, you can think of chamomilla and coffea. So they make the patient very disseparate, especially in labor pains. Aurum with the pains going to the state of suicidal, going to the state of suicidal. Such a labor pains make the patient so disseparate. Labor pains with fainting, simsifica, naxomica, pulsatilla, and cyclica. It's a beauty. See this. Simsifica, we all know Actia racemosa, and Actia racemosa is a picture and a mixture of Ignitia, Staphysagra, nitrum. If you understand simsifigula very, very close, they have ill effects of grief, they have ill effects of disappointment of love, like ignitia like state, staff like state, like suppressed anger in simsifigula, and pulsatilla as well. Labor pains with loquacity, cophia. See this alternative. See this alternative. Here you see labor pains with disseparate making her. Cophia is there. At the same time, labor pains with loquacity, cophia. So now you can think this loquacity can be abusive, because the patient making disseparate with the pains. So that loquacity is in the manner of abusive, like corella rubrum, like corella rubrum. I think from Kent repertory, a single remedy rubric. Abusive pains from during pains they start abusing someone. Corella rubrum, and it's a beautiful remedy for cough. Wait for a while. Like someone has texted me that they want to join. Yes, yes. So coming to the next point of today, that is abscess, boils, carbuncles, sepsis. Think of gunpowder 3x. And it's a beautiful, beautiful remedy, I will tell you. It has never failed me in such cases. So gunpowder is a mixture of modern silicea. It's a mixture of modern HEPA sulf with a lot of blackish discoloration, because gunpowder is from carbon group of remedies. There must be a blackish discoloration, especially in the abscess, boils, carbuncles, and sepsis. Gunpowder 3x. I will tell you one beautiful chat. I think from the next point also we have this discussion. And in cases of abscess, in cases of boils, in cases of carbuncles, when your HEPA sulf, when your silicea is not at all helping, what remedy you can think of? What remedy you can think of? Please text in the chat box. Do it fast. When your silicea is failed, when your HEPA sulf is failed, not at all helping, what remedy you can think of? Yes, myrestica, 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 tarantula. Okay, fine. Nice suggestion. Yes, it's a myrestica. It's a myrestica. And if you read Boric, first paragraph, last line, it has more powerful action than Hepar sulf and silicea, myrestica. And Tarantula cubans is also one of the beautiful remedy for boils. Beautiful remedy for boils, which has spider group of characteristics like restlessness. You can see music aggravation. You can see dance desired for can be seen there. Think of these remedies. Other remedy you can think of is anthracinum as well. Anthracinum. It's also a beautiful remedy for abscess, boils, carbuncles. But in anthracinum, you need to have a lot of burning sensation, a lot of burning. And anthracinum is a state of nitrum like mind, arsenic like burning. Think of this: nitrum like mind and arsenic like burning. It's a remedy, anthracinum. Coming to the next. What? Think of thuja, causticum, nitrums, dulcamera, and acid nitricum. Dulcamera, what's especially on the hands and fingers? Causticum we see, it's a beautiful remedy for warts, never well sinks burns, single part paralysis. If you get the case of actually I'm doing one case of single sided paralysis, and the patient complains of involuntary urination. Single side of paralysis, patient complains of involuntary urination, cannot control urine. Causticum was given, but not at all helping. What remedy you can think of? What remedy I can think of? And I have given the next remedy, and it has done wonders. First, I prescribed causticum, but it's not at all help, not at all help with the patient. So I thought of the other remedy with same symptoms. Tell me the remedy. Equistinum, okay. Staph, okay. The remedy is Lathyrus sativus. Lathyrus sativus. Try to read from Bodic, I think. It's a beautiful, beautiful remedy for spine derangements, lumbar back derangements, with paralysis of single-sided paralysis, and having this involuntary urination. Lathyrus sativus. Coming to the next, Drosera. And Drosera, you see, it's a beautiful, beautiful remedy for tuberculosis, especially of any type of tuberculosis with glands, TB of joints, with allergic bronchitis. It has done beautiful, beautiful action. Here you see what Sir has mentioned in his book. Drosera in tuberculosis, it has cured innumerable cases of primary complex in a children and their allergic bronchitis. It has cured TB of glands and joints. And I will tell you, to understand Drosera very well, try to read from M.L. Taylor book. M.L. Taylor, she has beautifully collected information from different books and her clinical experience in Drosera, book of M.L. Taylor, Drosera. Read it from there. So coming to the next, that's what I said here. Tarantula cubens in carbuncles. So in cases of carbuncles, you can think of tarantula cubens with burning, especially with burning is there, you can think of this remedy. And carbuncles with diabetes, Crotalus horridus, lachesis, and Abroma augusta. I think many of you don't know about this remedy. Abroma augusta is beautiful remedy with bryonia-like symptoms having diabetes. Having diabetes. It has a state of bryonia-like symptoms with diabetes. Think of Abroma augusta and Crotalus horridus. I will tell you one clinical tip for Crotalus horridus, especially in cases of dengue, where platelets are drastically coming down, You can think of Crotalus horridus every 1 hourly one cap on the first day, second day every 2 hourly one cap, on the third day every 3 hourly one cap, like unlimited caps from the morning to until he sleep. And the next fourth day, go for the reports. Platelets will be going to the normal for sure. I have did at least of 5 to 6 cases with Crotalus horridus, and it was documented. Actually, it was documented in the book Margery Blackie, Mitra Medica, the patient not the cure. Margery Blackie, the patient not the cure book, and she has documented some cases of Crotalus horridus in 30 potency. In 30 potency. If possible, we'll be sharing the documents of Margery Blackie, her writings, her books. She is from Royal Society London of American Hospitals. Carbuncles on face, on chin, single remedy lycopodium. Single remedy lycopodium. See this, carbuncles with impotency. You can think of the remedy picric acid. So to get such rubrics like some pathological symptom, some mind symptom, or some pathological picture with other pathological or physical generals or some particulars, try to refer nerve repertory of hearing guiding symptoms. If you have an idea of reading it, it's a beautiful, beautiful repertory, I can say. There are a lot more rubrics with interlinking with the broad mind symptom, like anger with the lerosis of Seaver, single remedy noxomica. Single remedy in ophthalmica there. This is the beauty of understanding. Carbuncles with a lot of stinging pains like epis and nitric acid. Next, terbinthina in kidney trouble, well with glononine and ill serum. Ill serum. Ill serum. How beautiful. We generally don't think of glononine there, but sir has mentioned kidney troubles. You can think of glononine and terbinthina, we all know, and ill serum as well. In cases of CKD cases, chronic CKD cases, terbinthina, ill serum, and gingiva officinalis. Gingiva officinalis. If you refer Boric, I think he has written in the first line of the first pair of second line, I think, complete cessation of kidneys, gingiva officinalis. Try to read from Boric. And in cases of CKD, you can think of these three remedies. One is Ilserum, one is Apis, one is Apocynon. In Ilserum, with CKD, there is no swelling with no hypertension. In Apocynon, with lot of swelling, lot of thirsty, with history of alcoholism. In Apis, swelling, burning with thirstless. Swelling, burning with thirstless. Apis. And I'm doing one beautiful case. I think uh, the doctor is present in our webinar as well. We have prescribed Apis like 5 minutes, 10 minutes, 15 minutes dosage. And she was much better. She was much better in the swelling. She was much better in the swelling. If she's present here, she can text in the chat box. Coming to the next, insulin is used for low BP and low glucose conditions with dramatic results of 38th potency. Aconite is also have this high usage of this low BP, but with great fear. Fear must be there to prescribe aconite. Fear must be there to prescribe aconite. I think I don't have much clinical experience of this insulin usage in these cases, but SAR has documented in his book. Coming to the next, angioma of the face, single remedy abrotinum, single remedy abrotinum. And we have discussed abrotinum very well, very uncivilized child, very cruel child of abrotinum. And it can be used in infants with umbilical cases as well. For infants, children of umbilical cases, abrotinum works wonders. Here you see spider angioma. In cases of spider angioma, the appearance is like spider. We can think of cardasmer, meadow, and plumbum. To prescribe cardasmer, we need to have some liver complaints. We need to have some alcoholic history there. Medorinum, as I discussed before, plumbum with a lot of brain fag, memory loss, with some effects of lead poisoning, with multiple sclerosis in the action. We can think of plumbum. Fatak has mentioned only three remedies for angioma, that is abrotinum, lycopodium, and sulfur. Angioma affecting the whole upper portion of the right side of the face down to the nose. That is abrotinum. Coming to the next point here. Case of impotency and sterility cured with lac caninum as the patient has suffered a bad case of diphtheria with symptoms of changing sites. With symptoms of changing sites. I will tell you why I have mentioned this point and how important is the past history in prescribing the remedy for a patient. So here you see patient has suffered a bad case of diphtheria in the past and now patient complaining of impotency and sterility and the symptoms are changing. The changing sites like caninum, like pulsatilla, like stellar media, like stellingia, especially in the rheumatism you can think of there, with a lot of diphtheria here. Lac caninum has helped well. So in cases of this, past history is very, very important, very, very important to prescribe remedy, to prescribe a remedy. And to understand the past history, you can read Dr. Fobister's book of past history. I think he has mentioned in tutorials of Fobister of his book, where he has mentioned separate chapter of past history there. How important past history in prescribing the medicines, in prescribing the medicines. If patient have recurrent tonsillitis in the past, now patient complaining of rheumatism, you can think of the remedy streptococcinum. Streptococcinum. The other remedy is guacum officinalis with past history of recurrent tonsillitis with rheumatism. So this is what past history comes very, very important in the picture of case taking. In the picture of case taking. Coming to the next point. One more truth which I believe in This was written from SARS, exactly taken the sentence. If a drug has produced and or cured particular pathology, uh, I will explain you. I'll explain you. Particular pathology like enlarged liver, spleen, etc. in one person, it must be able to do the same in another cases of the same pathology, irrespective so-called constitution, so-called mentals, so-called individuality of the person. How beautiful he has written. This we need to understand. Sometimes we need to prescribe to the patient a pathological prescription or particular general's prescription. Pathological general prescription should be done in some cases where we cannot get the constitution, where we cannot get the mentals, where we cannot understand the person who is in front of you. So that's why to understand these, you need to understand the action of each remedy, the sphere of each remedy, where it acts, what is the location of the remedy, what are the modalities of this remedy, how this is helped in old school physicians, how this is helped in old school or old herbal medicines. From there, you need to extract the exact of this remedy. For example, if a patient gets of spleen pathology, nothing is there, we can think of Sionatus, because Sionatus has a doctrine of signature of spleen pathology. Spleen pathology. This is what is so much important. So to understand these tips, to understand this, try to read the books of Dr. Burnett, and he was one of the pioneer of homeopathy, has beautifully written many books, especially organ-specific remedies. Organ-specific remedies from Dr. Burnett, but it was started from Rademacher, who has first originated this organ-specific remedy prescription in homeopathy. In homeopathy. I feel it's not against homeopathy because it is indicated there. It is synonym to the pathology what we are about to prescribe. What we are about to prescribe. Try to refer some of the Burnett books. A lot of books are there of Dr. Burnett. Coming to the next point here. Pyrogenum to be used in streptococcal infection, whatever be the pathology, any sepsis indication, think of pyrogenum. Think of pyrogenum. In any sepsis condition, in high fever, especially in ICU cases where patient having constant high fever, even though we are giving some antibiotics, the fever is not at all coming on. It has having the spikes of 101, 103, 104. Then you can think of the remedy pyrogenum. Pyrogenum. In any cases of vomiting and diarrhea without any other information, think of pyrogenum and arsenic alum. And what is the picture of pyrogenum that we have collected for you all? Pyrogenum is restless and anxiety like arsenic alum, weakness, coldness like carbovage, bruised sore feelings like arnica, bony pains like eupatorium purpuratum, motion amel like rustox, rattling chest like antimonium tartarate. This is a beautiful combination of pyrogenum. It has works wonders in ICU cases, especially with a lot of sepsis, a lot of streptococcal infection. You can think of pyrogenum. Or in fever cases where you have prescribed some of the remedies, not at all fever is coming down, repeat pyrogenum 30 frequently. Coming to the next, the common pathology, psoriasis with RA, with rheumatoid, with psoriasis. Then think of radium bromide and guaiacum along with ars iode during his skin exacerbation period. How beautiful. Psoriasis with rheumatic complaints of RA factors, SAR has given only three remedies: radium bromide, guaiacum, arsenic iodatum. Radium bromide has modalities like Rustox. I will tell you beautiful thing is that patient comes and says, Doctor, now I feel a lot of leg pains. While walking, first two steps, I feel much pain, but after that, I feel much better. You have prescribed Rustox, not at all helping. Think of radium bromide. In Fatak, he has written better by continuous motion, radium bromide. Radium bromide. Guaiacum, I already said, with a lot of tonsillitis history, with rheumatism, and with ovarian affections also in this remedy you can see. And guaiacum craves for apple. Craves for apple. Next remedy, ars iodatum. Arsenic like restlessness, arsenic like anxiety, arsenic like fears, iodine like hot, iodine like emaciation, iodine like appetite increased. You can think of the when you get the combination of these, horse iodine does wonders. And it's a beautiful remedy for psoriasis. It's a beautiful remedy for psoriasis. Until and unless you get arse-like symptoms, iodine-like symptoms, not just blindly prescribing it. Until you get one of the clinical indication of arsenic iodine, it works wonders in skin cases, especially in lichen planus. Coming to the next point, teething and gums. In such cases, think of Merxol and Carbovage. Merxol and Carbovage. Aching in the gums, especially teething in children. Children teething with a lot of aching in the gums. Think of bryonia. Generally, we don't think of it. Bryonia. I think it is from Kent repertory. Teething difficult in compression of gums. When there is a lot of compression in the gums, teething comes difficult. Think of these three remedies: cicuta, phytoleca, podophyllum. And phytoleca is a beautiful remedy for mammocancerous cases, hard tumors like conium and philandrium. And phytolica you need to prescribe whenever you get a struck in a cases, whether to prescribe bryonia, whether to prescribe rustox. Patient is having bryonia like modalities, patient is having rustox like modalities. In rheumatic cases, you are struck what to be given, you can think of phytolica, because phytolica falls in between bryonia and rustox. Try to read Allen's keynote first line. First line. Coming to the next point, actually this is something interesting which I noted. uh, Maybe it is in the line of homeopathy or out the line of homeopathy, but I just mentioned here. See this, what sir has done in his experience: mixture of mustard and neem oil in equal proportion, the best for rubbing by the patient himself before bath, after vaping of oil. So why this is done is that when applied before bathing, the oils soften the skin, loses dirt, and allows medical constituents to penetrate into the pores. So especially in patients with chronic skin and rheumatism cases, this mixture of mustard and neem oil will help the patient to cure quickly, as sir has mentioned in his book, but it's not that much clinical experience about it. Coming to the next line. A remedy that has produced any symptom in a location is capable of curing any other symptom in that location. How beautiful, sir. This is what homeopathy is, I can tell you. This is what a grand generalization. This is what Boning Hussain sir has said. The grand generalization comes into the picture of play. Picture of play. If patient complains of upper limb pain with electric-like sensation, and same patient complains of lower joint pain, but he cannot able to sell the sensation, but you can think it is like electric-like sensation because patient has a whole, the same picture runs there. So that's why this grand generalization comes into the picture of play. Comes into the picture of play. A remedy that has produced any symptom in a location is capable of curing any other symptom in that location. How beautiful. This is pathological general. This is grand generalization, what Boning Hussain sir has mentioned. Next thing, same, that's what I said. If it has produced a particular sensation or an element in one part, it can produce, and when used homeopathically, cure that sensation or element in any other part of the body. So this is what holistic approach is. This is holistic approach. This is grand generalization. This is grand generalization. This we need to understand very, very clearly. Very, very clearly. This is wholesome of homeopathy. Coming to the next. A strong or a peculiar modality noted in connection with any sensation will be the characteristic modality of that remedy anywhere else in any patient from any other symptom or element. Same runs here. First, the run of the location, then the sensation, then the modalities. So that's why if you refer Boning Hussain repertory, he has mentioned separate chapter for amelioration and aggravation in generalities, because he is not finding to any particular thing. He is finding modality as a general character, as a grand generalization character. That is most important. That is most important. Coming to the next, crouping barking cough. Sir has mentioned three remedies: aconite, spongia, and hepar sulph. We have added some more information about it. Croup with urticaria, think of arsenic. Croup with stubborn, not at all going, then think of these remedies: arsenic, phosphorus, cupromet, and lacasis. Croup with a lot of recurrence. Recurrence is a lot, then think of lycopodium and phosphorus. Croup with cardiac, single remedy spongia. With cardiac complaints, with lot of croup, lot of barking cough, you can think of spongia there. Next point, Dr. Lippe, if from the numerical totality of symptom, we remove all those explainable by pathology of the disease, the remaining are the symptoms of the patient, is they that guide us to the remedy. Guide us to the remedy. How beautiful, how beautiful. So whenever you're about to repertorize, we generally repertorize cough. He has cough, okay, cough. He has liver complaints, liver complaints. So whenever you remove the pathological rubrics, what you have taken in your repertory sheet and the remaining symptoms of the patient, then the remedy which is coming into the sheet, that is the remedy for the patient. That is the remedy for the patient. So never go for calculating this numerical totality of symptom. Try to understand the symptoms of the patient in the picture, or the rubrics in the picture. That gives you a sole guide of prescribing the right remedy to the patient. Next point, one patient of Burnett remedies, that is Cardus Murnus, once cured a large varicose ulcer who was actually being treated for a liver and spleen complaint by Dr. Windle Bland. Today, this Cardus is equal to, if not superior to, Pulsatilla, Calcarea floor in cure of varicosity and their ulcer. And their ulcer. This is amazing. This is amazing. Generally, we don't think of these remedy, especially in varicosity, especially these varicose ulcers. Cardus Merck wonders. Cardus Merck has done beautifully. And after reading this book, I went to some literature of Burnett, like disease of varicose veins, disease of Burnett writings, like 50 reasons to begin a homeopath. In that book, he has mentioned this Cardus beautiful action of its varicosity in almost all the cases. In almost all the cases. It is documented very well, very well. So you can think of Cardus Mer with varicosity and ulcers, where you are about to prescribe Pulsatilla, where you are about to prescribe Calcarea floor. Above all, just think of Cardus Mer and with past history of liver or spleen and with past history of alcoholism. Coming to the next point, Hecla lava. It's a beautiful, beautiful remedy for ectosis, for necrosis of the lower jaw, necrosis of the teeth, for all sort of tumors. Hecla lava works wonders. Hecla lava is absolute certain remedy in our hands for all sort of tumors and exotisis. Hecla lava 30, useful for the neuralgia of pains after tooth extraction. After tooth extraction, patient complains of facial neuralgia. Think of Hecla lava 30. It was given by Fobister. And necrosis and sinus after masted operation. So whenever there is lot of necrosis, lot of caries of bones, lower jaws, you can think of this remedy Hecla lava. Going to the next point here. Abortion habitual, slightly retroverted, uterus which he reasoned was caught in the halo of the sacrum and the uterus could not grow freely. Symptoms are she feels a lack of room from fetus in uterus, inability of uterus to expand, that is threatened abortion. So in cases of threatened abortion, there is no lack of room of fetus to expel, then think of these two remedies, plumbum along with that aurum nitrate. Plumbum and aurum. And I will tell you one beautiful, beautiful clinical trick to prescribe aurum. Uh, Burnett has used beautifully aurum for uterine fibroids. It's a beautiful remedy for uterine fibroids with constitution. With constitution, I have did two cases of this uterine fibroids. Patient having I have prescribed constitutional medicine and intercurrent aurum 30 or 200 weekly one dose we can give because auromion has the exact action of uterine fibroids. If you read Phatak Metromedica, Boric or Phatak, I think, Burnett has given it's a golden rule to prescribe for uterine fibroids. Aurum urnat. Aurum like state, mure like element of disappointment, and nitrum like state you can see in this remedy. Aurum urnat. Coming to the next, some from knowing people, some from reading proper books, some from seeing people doing the work, some from discussing with other workers, some from self-thinking, some from trying and doing. We gather the knowledge as a drop by drop of a rain makes the ocean. The rain makes the ocean. This is what I did in my career of homeopathy. In a very short career of homeopathy, I can say, because I started learning homeopathy in my second and third year. In second and third year, everything I can tell you. Even in my dreams, I used to get I'm repertorizing. I used to get I'm reading some remedy. I used to get some. I'm taking the case of some other persons. This is the beauty. Try to immerse in the knowledge of homeopathy. Everything we can learn. Every person, whenever you go out, if some person is scolding someone due to some anger, then think of Naxomika. If somewhere there is an accident, someone immediately stops the bike, go and run. And what happened? What happened? Doing some CPR. Kya hua? Can be prosperous, can be causticum. Very sympathetic, very helping nature. You're going on the bike, someone from the car started nauseating, cocculus, petroleum. In your college, if some teacher is about to teach, this is the beauty. So from everyone, every known person, from unknown person, from proper books, homeopathy is everywhere. From there, you gather the knowledge. Try to make it gathering from drop by drop, drop by drop. Every for 1 month, you have collected 100 drops. For second month, you have collected 200, 300. Make an ocean of knowledge. That is the beauty of homeopathy. And I will tell you one thing: not one book is final in homeopathy. Not one Mathematica is final in homeopathy. Each book has its unique way of prescription. Each book has its unique way of explanation. Each book has its unique way of writing and understanding. Every book is important for us. Every book is important. Hard work will fetch you a lot of results in your clinic. Uh, Continually work for 6 months. 6 months. Continually work with 6 months. If anyone is interested to work with us, we are welcoming them. They can come and collaborate with us. We'll be guiding them as well. So continuously you can work for 6 months with proper guidance, with proper books of Mathematica, with proper books of repertory, with proper books of organ and understanding. Each and every, like how to read Boric, how to read Nash, how to read Clerk. Everything is important. Everything is important. Coming to the next. This is we already discussed. Take an example of boils. Most of use of Bell, Merck, Hypersulf silicia, the chance of our using Myristica or Tarantula cubans and find a drastic result, this stamps itself on our memory. This we already discussed. Next, digitalis. Digitalis has an indication of jaundice and also that it is good remedy for prostatic enlargement. Digitalis has been used almost in every case and now it ranks equal to Chelidonium China in jaundice. How beautiful, how beautiful. Actually, I'm doing one case of hepatitis A with liver infection. Patient have jaundice of bilirubin level was 10 actually, 10. And I have prescribed the remedy that's constitutional. Within 4 days after that, bilirubin level comes to 6, from 10 to 6. Now patient is absolutely normal. Hepatitis A virus was detected and it is also a normal. And we can give the results with very fast, until it is indicated exactly. Until it is indicated exactly. Digitalis to be indicated in jaundice and albumin used in intermediate pulse rate, it can be used. So digitalis can be comes very close to jaundice like Chelidonium China. Chelidonium we all know, and beautiful remedy, Chelidonium for like for jaundice. I will tell you. And if you are prescribed lycopodium, it has partially helped the patient, but he is lycopodium and is not at all helping. The cure has stopped at one certain stage. Then you can think of Chelidonium. Read Fortac Mathematica. He has mentioned this line. If lycopodium fails to act, think of Chelidonium. And Chelidonium has one key symptom, pain in the scapula. And Chelidonium craves, desires for very hot tea. The fumes must come out of the tea if the Chelidonium patient wants to drink. It's a key confirmatory of Chelidonium. Coming into the petroleum can be used in Meniere's disease with very wonderful results. It has a modality aggravation in the winter. Meniere's disease with winter aggravation, petroleum along with motion sickness, you can see, along with dry skin of petroleum. Meniere's disease with seasickness, think of tobacco. Meniere's disease with tinnitus, chininum sulf and iris versicolor. Chenopodium is one of the beautiful remedy with trooper of auditory nerve, hearing better in high pitched sounds with oral vertigo. These remedies, what I mentioned, will works wonders in Meniere's disease. Wonders in Meniere's disease. Chininum sulf is a beautiful remedy I have done in some cases, and iris with lot of headaches, with gastric complaints, with this Meniere's disease, with this Meniere's disease. Next, petroleum in gastric ulcer. If stomach pain is better by eating and few symptoms are present of petroleum, petroleum highly cures more cases than anacardium, chelidonium, graphitis, sulfur has the same factor of better by eating. Better by eating. How beautiful, how beautiful. Petroleum for gastric ulcer. This is beyond thinking of what we generally think of a dry skin, cracked skin, or for motion sickness. But SAR has used beautifully in gastric ulcer with the modality of better by eating. And it has cured more cases than anacardium, than chelidonium, than graphitis and sulfur. Dr. Borland, one of the beautiful homeopath, one of the eminent homeopaths, he has given one beautiful clinical tip that is seasickness with occipital headache. It is Borland. Next, a lady of pregnant lady of 8 months found suddenly that this. Actually, I'll tell you, I did one beautiful case of this, but unfortunately, uh, baby development is not that much. So allopathic gynecologist doctors said to abort the baby, but patient has come with fetal heart sound is absent. Fetal heart sound is absent. CPR was given 1M and it has worked wonderful. The heart sound were very littly, very minutely came back to the baby, but the thing is that baby is underdeveloped. So that's why the patient, the doctors have advised for them for abortion. In one case, only one case, I have proved CPR. In further, if I get such cases, CPR works wonders. And I have seen this prescription from my guru as well. See this. Fetus was not moving, then I given her CPR 1M because it has a symptom of fetus movement slowdown, almost imperceptible within 3 hours. The baby started moving. The same symptom can be noticed in the colophyllum. This was experience from SARS itself, from the book of the SP Koppikars. CPR for fetal sound, absent fetal sounds, you can CPR, you can think of CPR 1M. Next, Aeschylus can be given for the pain in the second molar from Kent's repertory. It can be used in curing more cases of weak back pains, of lumbosacral pains, than the cases of piles. Then the cases. So we generally think of piles with backache, they do Aeschylus. Yes, fine, it's an indication. But without the indication of piles, if patient has weak back with lumbosacral pains, Aeschylus has done wonders. Aeschylus has done wonders. Like Kalika as back pain, weak, with sweating, with weakness, with lot of anxiety. I will tell you one of the beautiful clinical tips for you all. In cases of backaches, where you have prescribed rustox, berries, and your well-selected remedy is not at all helping, think of the remedy verolinum 30C, low potency, frequent repetition, works wonders in backaches. Works wonders in backaches. Verolinum 30C. Next, tonic remedies like Aeschylus, Cocculus indicus, Kalika, working immediately and strengthen the patient. By the way, both Aeschylus, Kalika have piles that the later after delivery. So delivery after piles, Kalika and Aeschylus comes into the picture, and these remedies have a tonic remedies for strengthening the patient. Next point. Weakness remains of small remedy, that is sarcolactic acid. Pick up after influenza or dengue. So there is weakness after influenza. We can think of gelsemium, obrotinum as well, scrutulania, and lathyrus. This was from the Metro Medica which I collected. Gelsemium we all know, obrotinum also, scrutularia and lathyrus. And sarcolactic acid, what sir has mentioned in his book. I will tell you another thing, Lycopersicum esculentum, a tomato, that is tomato, especially influenza after rheumatism. There is lot of dengue, there is lot of weakness or influenza, then patient develop continuous pains, joint pains, rheumatism. You can think of the remedy, Lycopersicum esculentum. Post viral rheumatism from Boric, bold letters he has written. Next point, Argentum nitricum, it's a greatness in thyrotoxicity or goiter with palpitation, high pulse rate, emaciation, and hunger. So if you get a case of goiter, if you get a case of thyrotoxis, have a concomitant of palpitation, high pulse rate with emaciation and hunger, you can think of argentum nitricum. At the same time, argentum nitricum patient craves for sugar, candy sugars, and anxiety, anticipatory anxiety, you can see in this remedy, like medorinum, like gelsemium. But in gelsemium, the dullness. In medorinum, the same activeness. In argentum nitricum, restlessness with this anticipatory anxiety. And argentum nitricum patients have this claustrophobia, fear of narrow places. I'll tell you. And you have in these cases, you have prescribed argentum nitricum, but not at all helping. Exactly, the patient is picture is argentum nitricum, but not at all working at all. What remedy you can think of? Do it first. What remedy you can think of? Yeah, the remedy is dysentery co. It is from bone nosode, comes very close to argentum nitricum. Dysentery co. You can refer from Allen's, it's there. Coming to the next, vertigo with noise in the ear and deafness. Think of petroleum, nitrum salicic acid, chenopodium, catch like pain in the left scapula. Right, this we already discussed. And nitrum salicum acid is one of the beautiful remedy for this vertigo, noise in the ear, with tinnitus, with deafness. I have read this from the documentary of Marguerite Blackie, The Patient Not the Cure. She has prescribed nitramsol for almost all such cases with beautiful results. Next, vitamin deficiency, ulcers in the mouth, think of nitramure, mark salt, borax. When they are not working, think of using Kondurango sixth potency. That's we already discussed. Kondurango is a beautiful, beautiful remedy for cancer of esophagus, cancer of stomach, with corners cracked at the lips due to vitamin deficiency. Is it clear? Is it going well? Coming to the point number 43, a rhododendron. It's a fine remedy for orchitis with rheumatism of rib joints in stormy weather. In stormy weather. So whenever you get the cases, this rainy season running up, whenever you get a cases from an area where is a lot of windy weather, lot of stormy weathers, patient complaints of rheumatism or this orchitis like complaints, you can think of rhododendron. Coming to the next point, Ruta used for two things. One is eye strain. We everyone know about eye strain, straining of eye after studying, after screening, eye pain. Think of Ruta and prolapse of Anne after labor. Interesting, right? Interesting. Of course, we need Podo and Ignitia in such cases. In such cases, this is interesting point. Ruta, especially prolapse in Anne after labor. Ruta does cure ganglion and cure cyst under the skin like Beretta. Beretta also has this action of curing ganglion or cyst under the skin. Next remedy, Cocculus indicus, Naxomica are the two great remedies for those absolutely exhausted by their attendance on the sick person, especially night watching. Care worries for others, cannot able to sleep for them, stay alone in their bed of the sick person, stay there, stay for them, care for them, do for them. Then the next day they fall sick. These two remedies works wonders. Cocculus, Naxomica. As I said, Cocculus, care, worries for others, sympathetic like causticum, motion sickness you can see. But in Naxomica, with the symptom of irritability, anger, perspiration while eating, some of key conformity, desires for spicy, desire for purgative, alcohol, that is the state of Naxomica. It is quite opposite like Cocculus. But these two remedies have worked wonders. New tissue not recognized originally, then arnica may be followed by hypericum in nerve injury, trillium bleeding. Example, after extraction of the tooth. So after extraction of tooth, there is a lot of bleeding. We can think of trillium pendulum. So generally we think of trillium pendulum in female disorders where the bleeding is not at all stopping. Bleeding is continuous for 4 or 5 days or for months. In such cases, we can think of trillium. At the same time, trillium has the action of bleeding extraction after the tooth. What I'll tell you one bit, you just mentioned. In cases of injury after injury, we have prescribed arnica. It is not at all helping. What remedy you can think of? What is Indian arnica? Tell the remedy from Boric. Indian arnica. Which remedy he has mentioned? Indian arnica. Do it fast. Indian arnica. I'm waiting for your suggestions. It's a beautiful remedy. It was written in Boric. Terminal Arjuna. Yes, good, good. Nice, nice suggestion. It's also, we can think of that remedy with heart complaints. It's a good suggestion, doctor. Nice suggestion. The remedy is Vitex trifolata. Vitex trifolata. It's an Indian arnica from Boric. Vitex trifolata. Coming to the next point, Bellis P for injury to abdominal viscera. Interesting, right? We generally think of spine, train injury, but injury to abdominal viscera, Bellis pernis works wonders. And Bellis pernis is a beautiful remedy for gardeners. It was given from Burnett literatures. I think it was written in Boric or Fatak. He has mentioned with a Burnett name. Sulfuric acid persisting ecchymosis you can see in this abdominal viscera. Drosera without any intercurrent is seldom beneficial, like sulfur and veratrum. That's what I said. Drosera has a beautiful, beautiful action. No one, I think, try to read Drosera from ML Taylor. ML Taylor. It's a beautiful remedy. I think beautiful. It is beneficial in almost all the cases if it is indicated. If it is indicated, it's a beautiful remedy of Drosera. If possible, we'll be doing a next session on Drosera. Most probably, we'll plan based on your suggestion, based on your feedbacks. Drosera, try to read from ML Taylor. Last point for today, acetic acid and vinegar have been used successfully to antidote strong drugs like aconite, anesthetics, opium, stramonium, tobacco. But if used against some others like belladonna, arnica, they increase the sufferings. They increase the suffering. See this. This is you need to understand how the remedy action, what the action is, what is this aggravation, how it is beneficial, how the side effects. That you need to understand from the each remedy. So thank you all for joining our session. This is our YouTube channel. You can subscribe and make it 1K subscribers. Try to share our YouTube channel links. Um, try to share of this. Try to share your feedbacks. Try to share your feedbacks in the chat box. This is our. If you scan this, you will be getting our WhatsApp link, Instagram link, and Telegram links as well. You can join there for next further sessions. And if you have any doubts, you can text me. And please, everyone, please share your feedback in the chat box. We'll be waiting for your feedbacks. Every one of you, how many of you joined? Please share your feedbacks. Share your feedbacks, please. Is my voice is audible? I think, is it clear? No one is responding at all? Yes. Still, we want some more feedbacks that will make us very interesting in the coming sessions. Like what you have learned in this session. What is the key take from your session? Please text here. Yes, doctor, you can join. You can scan this QR code which is on the screen, so that you will get almost all our links. Almost all our links. Yes, we'll be uploading in the YouTube. Please make subscribers of 1K. We are going to upload this video there, and many more videos are coming up as well. This is our link. Please scan so that you will get almost all the links of our social media handlings. There you can join from there, and you can message me personally from the group. You will get the group admin numbers. Waiting for some more feedbacks. Please share your feedbacks, and if you have any doubts, you can text me. Okay, thank you. And if any, we'll be waiting for a few more minutes. You can share your feedbacks there because that will make up for next sessions. Because we are doing a lot of hard work, and behind this hard work, uh, one of the doctor Vijay Rama Rao, he is working hard for us to get these PPTs done on time with nice editing, with collective information. Yeah, in the next session, we are going to cover next 50 for sure. Make this session, make our subscribers 1K. We'll be uploading there. For the 2 sessions we have planned for this. Still, if you have any doubts, you can text me. We'll have a discussion. So in sciatica, if the complaints go from right to left leg, then we should indicate the lycopodium. Now, but if the lycopodium not works, which remedy we can think of? See, it's side affinity as you said, but in sciatica, you need to understand if there is any numbness. If there is numbness, you can think of gnaphyllum, one such a remedy. And sciatica to prescribe, Fatak has given two beautiful remedies. One is Rustox and Colocynth. But Rustox with sciatica, there has to be Amal by modality. So in case of the sciatica, try to ask for modalities, especially not from the side affinities, but try to ask the modality. If there is any numbness, aggravation from motion, or Amal from motion, and ask the patient to lift the leg up so that the bending of the sciatica, you can think of Colocynth there. You can think of Colocynth as well. Is Tuja specific for what potency works best? So, doctor, there is no specific remedy in homeopathy, frankly speaking, until and unless it is indicated to prescribe Tuja. If you get warts with Tuja, try to ask the patient craves for onions or aggravation from onions, they desire for tea, and oily face is very greasy and oil. Tuja like mind state, Tuja like fixed state, Tuja like delicate feeling of the body. That is the thing of Tuja. There is no specific remedies in homeopathy. Until you get one strong symptom of that remedy, you can prescribe, it works wonders, whatever may be the pathology, if that symptom is indicated to the patient. Puja is religious. Still any doubts? So shall I going to end the session? You can scan there if no one is joined, and try to subscribe our channel. Okay, I'm ending this session. Thank you everyone who has joined this session, and we'll meet in the next coming sessions. Thank you. Please share to your friends and your group as well. Thank you so much.